Hello, hello. Welcome, welcome, welcome. Come on in, guys. Give me 1 second. I'm going to try and get our second page on here. Hello, hello. Come on in, guys. Join in. We're going to be right. We're going to get started in just a second, guys. Come on in. Can you guys hear me? Give me 1 second, guys. I hear a little feedback, guys. Can you guys hear me? Give me 1 second. Let me get further away. There we go. I think that's better. Welcome, 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 guys. Thursday Lives with Whitman-Walker. As you guys have heard or not heard, this will be my last live with Whitman-Walker. As in, we're going to have new influencers coming in and joining part of the team. So we are rotating. That's why some come in and some go out. But definitely super excited to have been a part of this. So thank you for everyone. Just going to wait a couple minutes for everyone to come in. Come on in, guys. If you have any questions, please feel free to ask. Give me 1 second. Let me just make sure I pin my information. Come on in, guys. Say hello. Don't be shy. Hello, hello. So yeah, guys, pretty much you guys have known I've been doing influencer for Whitman-Walker for the past almost about 2 years. So we usually talk about different topics, and we talk about being super careful with COVID, testing, making sure you get tested, making sure you stay safe, just making sure your mind, your health, everything is good. So come on in, come on in. Hello, hello. Welcome, everybody. Sorry for trying to get everything together because I'm on both pages today. But I appreciate everyone. Like I said, today is my last day doing lives for Whitman-Walker. I mean, you'll see me around. I'll still be part of the team and going to their events. So make sure you follow them. So as you know, during the past year, Whitman-Walker Health Community Health Department has expanded outreach efforts to social media platform. We cover various topics about HIV, STI, sexual health practices, access to care, social determinants of health, and general public health interventions. The series we've been doing for the past year focus on current pandemic, COVID-19, ways to manage your sexual, personal, mental health. The community health team is always here to help and educate. So for those of you who've seen my lives and have pretty much come in and heard information we've talked about, you know the deal. Come in, ask questions. If I don't know, you can send a message to Whitman-Walker and they can check for you and get you some resources and information to help you out in those situations. Now, a little bit about Whitman-Walker. They are located in the DC area, so they're pretty active with helping with, HIV testing and STI testing, but they also do a lot more things. So for those of you who don't know, they help with medical care, behavioral health care, dentists. They have a pharmacy, as we spoke about earlier, HIV, STI prevention. They have nurse-based case management, testing and treatment, retention and engagement care, coordination. They help with the community health, nutrition. They do acupuncture, yoga massages, aesthetic medicine, legal services, insurance navigation, gender affirming surgical care navigation, youth and family services, research, clinical, and community education. So, as much as we really talk about COVID and prevention and vaccines and HIV and STI, they're pretty much a medical center. So, if you have questions about not having insurance, or if you have questions about legal matters, please contact them. Whitman-Walker, they have a couple locations in DC, but send them an email. There's a phone number that you can call to make sure if you have any questions. More things they worry about: programming as diagnosis, more targeted toward HIV testing, integrated screening activities, sexual health and wellness clinic, mobile health initiative. They have a mobile that does go out. They're just starting to get back out, so you'll see them a little more often, where they're either testing or giving information or handing out free condoms, handing out free lube, just making sure people are aware about getting tested, staying safe. They have walk-in integrated HIV and STI testing and treatment. They deal a lot with linkage, re-engagement to HIV medical care, partner service referrals, viral suppression medication adherence, Fast Forward, which is a WWH Rapid Start program. Also prevention and prep. They have a prep clinic, prep navigation, prep related psychological supportive services, condom distribution, and most likely what we're doing is social media outreach. So we're just trying to reach people who don't have access, people who don't, like the internet, who don't know how to find information, who don't know how to get tested. We try to focus on those areas where it's less common to, talk to your parents, or you have no one to talk to. So we try to just get information on social media. So for that one person who was wondering or is, curious about certain information, you guys can contact Whitman-Walker. Whitman-Walker, I've heard of Whitman-Walker before I started working with them. They've always had a walk. They're going to have a walk this year, but you can do it virtually. So if you can't attend, you can definitely join. Go to Whitman-Walker's page and you'll see all about it. It's going to be October 23rd. But more importantly, just remember, stay safe, get tested, keep your body, your mental health is very important, because mental health is health. So if you have any questions relating to testing, even if it's just regular medical information you need, give us a call. Because if you don't have a doctor, if you don't have insurance, they can talk to you and tell you what process you can take to actually go in and see someone. All right. But yeah, I love Whitman-Walker. I'm always going to be part of the Whitman-Walker family. So if you have any questions, feel free to ask me. I'll get you in touch with whoever I can that can help resolve your issue or questions or curiosity. But yeah, so definitely follow Whitman-Walker. Whitman-Walker is totally legit. They've been for years helping people be informed, which is number one, just getting people informed and helping people understand the process. And especially now with COVID, make sure you're staying safe. If you're vaccinated, great. I'm gonna give you more information about that. If you are not sure about getting vaccinated, contact them or contact your medical provider, and they can definitely tell you exactly what you might be doubting in, what you might be curious about. Yes, I will miss you guys too. Don't worry, you'll see me in the comments all the time. But as I was mentioning earlier, if you've gotten vaccinated, congratulations. You've taken a really important step to preventing yourself and your loved ones and your communities from illness. The Delta variant is soaring across the United States at the moment, and it's totally understandable why you might want to keep wearing your mask. The vaccine isn't 100% effective. It's more contagious. Variants are spreading, and there are very few protocols in place to actually verify who is vaccinated around you. So please stay alert. If you haven't been vaccinated and you're looking for an appointment, Whitman-Walker Health has COVID-19 vaccines available. Everyone ages 12 and up are eligible for the Pfizer, and everyone ages 16 and up are eligible to receive a COVID-19 vaccine. So they probably have all three, if not one or two of them. So please reach out at 202-207 2480 to make an appointment. If you're having trouble making an appointment with a Whitman-Walker, for DC residents, you can find information on COVID-19, vaccine walk-up locations, and eligibility at vaccinate.dc.gov or by calling 1-855-363-0333. Track the speed of COVID-19 vaccination lines by visiting coronavirus.dc.gov/don't wait. Now, for my Maryland residents, For my Maryland residents, learn more about the vaccine distribution process and schedule a vaccination appointment at covidlink.maryland.gov or by calling 855-634-6829. If you live in Prince George's County, visit the Montgomery County, visit their vaccination registration portal here, or call the 240-777-0311 to schedule an appointment. For my Virginia residents, learn more about the Virginia vaccine distribution process and schedule a vaccination appointment at vaccinate.virginia.gov or by calling 877-829-4682. If you haven't been vaccinated and you're not looking for an appointment, please continue to follow your CDC guidelines, mask wearing, quarantine, social distancing, and the likes. It's very important that you get the vaccine, discuss your COVID precautionary measures with those around you, and be mindful of mask, keeping your distance, especially if you are not sure who is vaccinated around you. If you want to support Whitman-Walker, as I mentioned earlier, register to walk, run, and donate to this year's virtual walk and 5K to end HIV on Saturday, October 23rd. This year marks a special year. It's 35th anniversary of the walk. Register yourself or your team at walktoendhiv.org. So remember to follow Whitman-Walker. If you're curious about testing, about COVID, about vaccinations, please call, email, or contact her on any other social media, Facebook, Instagram, or Twitter. And remember that we also have information on the website, www.whitmanwalker.org, for the most up-to-date information and all the services. And for more COVID-19 resources and general Whitman-Walker services, please call us at 202-797-4439. Follow some of our programs on Whitman-Walker Family at Real Talk DC _, No Filter DC, and The Corner DC. So like I said earlier, guys, I kind of told you today what kind of services Whitman-Walker does offer. So if you doubted something they did, please go to their website. They have a list there, and pretty much information is all there for you. Email them, call them, get tested, stay safe, wear your mask, get vaccinated, check on your friends, make sure that, we remember to watch out for each other, look out for each other, look out for your friends. Remember, we are here, we see you, we care for you, and we appreciate you all. And with that said, this will be my last goodbye. But who knows? Maybe you'll see me in the future. So I'm sure I'll see you around. If you see me in public, say hi at a distance or have your mask on and come say hi to me. Classes will start up soon. So if you're from the DMV, you might see me out teaching lessons here and there. I appreciate you all. I will see you soon. And don't forget to take care of yourself and talk to your friends and keep everyone. Just keep contact with your people. Talk to your parents. Talk to your family. Make sure we help everyone stay sane. Because in these days, everything is crazy, crazy, crazy. So with that said, I appreciate you all. I will see you on the streets or on the dance floor. Thank you to all my Whitman-Walker family who's been here to support me and been in my chat to make sure they write all the information I need. We miss you all. Stay together, stand together, and I'll see you when I see you. Peace.